A Lincoln toddler spent 8 days in the hospital after a rare complication from COVID.
Tonight, her mother shares her story. Channel 8's Yosef Nasser has more, and this is a story you can only see right here on Channel 8.
Can I help you? Campbell's our middle child. She's always been incredibly spunky, sassy, developed way ahead of schedule with everything. Basically ran before she walked.
On a Monday in mid-January, Stacy Sheridan's spunky daughter Campbell was diagnosed with COVID-19. Initially, Campbell had mild symptoms, low-grade fevers, a cough, nothing to suggest that something was seriously wrong, until Campbell started complaining of leg pain.
She couldn't walk at all. She, even touching her leg, would cry in pain.
Stacy says she didn't think much of it at the time.
I thought maybe this is just normal aches and pains with COVID. Maybe she's having growing pains.
She took her daughter to their healthcare provider, where they found out that one of Campbell's enzymes was elevated and showed extreme muscle breakdown from inflammation in her muscles, presumably from the COVID infection. She was admitted to Bryan East that night.
She was extremely dehydrated. She hadn't peed in like 16 hours in an intense amount of pain.
Doctors found that Campbell had rhabdomyolysis, a serious medical condition that occurs when damaged muscle tissue releases toxins in the blood, which can damage the heart and kidneys and cause permanent disability or even death. Stacy was told there were only 3 documented cases of COVID causing rhabdo in kids.
That was definitely the scariest part, is that this wasn't something that they've seen.
After an orthopedic surgeon expressed concern about the integrity of Campbell's legs, she was rushed to the Children's Hospital in Omaha, where she was put through aggressive IV hydration.
We had no idea if there would be long-term effects, if she would need dialysis, if she would need surgery.
The toddler spent 8 nights in the hospital. Stacy says she started to see her daughter turn the corner after day 5 or 6. She was ultimately discharged on January 31st.
Once she kind of rounded that corner, she just took off, and she's basically back to normal.
Stacy hopes her family's story can help others recognize signs and symptoms of COVID-19 early, so they don't have to experience what Campbell did.
COVID is an intelligent disease, and it sometimes doesn't give us rhyme or reason who it decides to pick on. We just feel incredibly blessed.
Reporting in Lincoln, Yosef Nasser, Channel 8 News.
And Stacy says she's not entirely sure how Campbell got COVID,
but says that aside from being a little weak going up and down stairs, she's basically back to normal. The family does not expect any long-term impacts from the illness.